So you say that there is an alternative than cutting and stitching for gum disease. What is it? You say lasers.
I'm a periodontist. I've been practicing for 2 decades. In the past, we would do deep cleaning, and then if that didn't work, we would go into something called periodontal surgery, which is where you're cutting the gum tissue and then having to suture. Now, patients, even though that may be very effective, patients didn't like it. It didn't provide them the comfort and the aesthetics that they're looking for. There's something called laser-assisted new attachment procedure, or commonly known as LANAP. I'm one of the few in the area, in the Philadelphia region, who's able to provide this for patients. It's a technique, it's a protocol. I'm using a laser, state-of-the-art laser, which is going to evaporate the bad bugs which cause this disease, and it's going to selectively remove the infected tissue. It's not like I have to go in with a knife. So it's like a bacterial infection that is killed with the laser. Is that right? I love it. So what causes this disease? Bacteria, bugs in the mouth. And when patients hear that, they're like, oh my God, bugs in my mouth, get rid of it. So it's going to absolutely 100% eliminate the bug around the gum tissue and around the tooth. But secondly, this is where it's been so tough in the past. How do you selectively eliminate the infected tissue, our normal gum tissue that's been infected with bacteria, that's got this inflammation going on, without cutting the healthy stuff away? In the past, it was with a knife. Now I can go in with a laser, which looks like a little tiny wand, a tiny little fiber. It's the width of 3 hairs. I can go into the gum tissue, and the laser does all the work. It eliminates that infected tissue. It obliterates the bacteria.
So no more bleeding gums, bad breath?
No more bleeding gums, no more bad breath. Gum tissue looks red and healthy. And get this, not only does it eliminate it, it's actually going to regenerate bone, which is going to make the teeth stronger.
Okay.
And it's going to improve the quality of the gum tissue. It's going to look healthy. And like you said, we don't have the bad breath anymore. The teeth are starting to feel more comfortable.
So loose teeth feel better, they get stronger.
Bottom line.
So no more cutting, stitching, you say?
It's a thing of the past, Randy. We don't need to do that.
There's only less than 10% of periodontists that are using this laser, statistically.
Correct. We have about 10%, according to the American Academy of Periodontology, only 10% are using this. Those are the top 10%. 10 years ago, 20 years ago, nobody was using bone graft. Nobody was thinking ahead
so you love
about
this
regeneration. It is cutting edge. It is where everybody's going to be 5 years from now.
Okay, good.
And I'm forging that at this point.